Do you struggle with venous leakage and erectile dysfunction? Namaste. Welcome, gentlemen. It's Anita Tadavarthi. I'm a licensed acupuncturist for the past 20 years, and I've treated 100,000 patients in my lifetime. I've seen this in my practice, and I also got this question on YouTube. And now I want to share with you a simple self-care acupressure protocol you can do at home. How does venous leakage parlay into erectile dysfunction? Simply put, there's not enough blood flow to sustain an erection. So what I want to do is present to you a concept in Chinese medicine. From my practice and my clinical experience, I have noticed that over time, on the lower leg, the kidney, spleen, and liver meridians on the lower leg and foot do an excellent job of helping with leakage. It could be blood flow, it could be urine and or stool. So this can be also helpful if you're having leakage in other ways. So I want to share with you a protocol that I've developed that has worked with my patient base, and I'll show you on my foot. I also want you to, of course, couple this with nasal breathing. So you're going to hear me in the background nasal breathe. Breathe in from your abdomen and or chest with your mouth closed with one or both nostrils. I prefer that you do it as best as you can in a seated or laying down position. Also, the speed is up to you. If you can go a little slower, you can do it for longer periods of time. But if you are seeing better results with doing rapid nasal breathing, you can do that as well. Also, I absolutely want you to partner with your medical doctor. In my practice, I of course do the acupuncture and the acupressure, but I partner with medical doctors. With venous leakage issues, you want to get checked out by your medical doctor. There may be medications and procedures that your doctor may advise. You of course can do this acupressure protocol along with your doctor's recommendations. The two combined can be very powerful in helping you along the way. And also, consistency is so very important here. I want you to do this protocol that I'm about to share 3 times a day minimum for 3 minutes each time. I'm only asking for about 10 minutes of your time. But if you can do that consistently along with your doctor's care and also practice nasal breathing along with this acupressure point, it can help you. So with that, let me share with you on my foot what to do. Here we go. Every morning, afternoon, and evening for 3 minutes each time, I want you to take the palm of your hand, and you can do either foot alternating between both lower legs. And I want you to take the medial aspect of the lower leg, and I want you to acupress just like this. And the speed at which you do it is up to you. The pressure at which you do it is also up to you. Also, what I'd like for you to consider is that you get the most medial aspect of the lower leg, which represents the kidney meridian. Also, on the medial aspect or in the middle of the lower leg is the spleen meridian. And on the tibial crest is the liver meridian. So what I want you to consider doing is to acupress just like this along with nasal breathing. What I've seen in my practice is that this has helped with leakage, not only of blood, but also of urine and or stool. Keep in mind that the entire body is mirror image on the lower leg. And of course, the root of the genitalia is represented on the foot, and each of the toes represent the penis, eggplant, and or genitalia. So for the next minute, what I want you to do is follow along. And of course, please don't forget to nasal breathe while we acupress. Here we go for the next minute. Most of my patient base has reported back to me that they see improvement in about a month. And so stay consistent with it, morning, afternoon, and evening. And of course, partner with your medical doctor. Thank you for sharing this topic. And also, if there's other topics you want to know more about, comment down below. If you got a lady friend, ask her to head on over to TikTok and Instagram. There's some great women's health there. And lastly, whether you're watching us on YouTube, TikTok, or Instagram, we are using the monetization money to establish a free clinic in my hometown of Washington, D.C. So thank you for your support. If you want to give a donation, please consider the link in the description or the first link in the link tree. Thanks for watching and your support. Wish you all the best in being a man on the planet from your friend and acupuncturist, Anita Tadavarthi. It's Anita Tadavarthi. I want to use my 20 years of clinical experience in giving you the best of self-care acupressure protocols to help you along the way. Please comment down below and let us know if these protocols are helping you. Most patients report that they see results within a few weeks to a few months. And if there are topics that you want to know more about, comment down below. Your feedback shapes our content. And also want to give you a special message that we at Empirical Grace are doing just amazing things. We are putting the monetization money from social media towards establishing a free clinic in the Washington, D.C. area. I am from the Washington, D.C. area originally, and this has been my lifelong dream. So just know that as you watch our videos, the monetization money is going towards a great cause. And if you want to donate, you can do so using the first link in the bio. Thank you so much for believing in us, and I wish you all the very best in being a man on the planet. From your friend and acupuncturist, Anita Tadavarthi.
We would like to thank Anita's friends and business contacts who donated their time, money, and medical supplies to the Rapely Free Clinic.
We're here in my grandfather's marriage hall, which is now being converted into our clinic or free hospital. We have been here for 4 months, and we have treated about 1,000 patients with over 8,000 or 9,000 patient visits. Most of the patients are farmers and agricultural workers, so a lot of the things that they're dealing with is pains, lots of different types of